Hello, this is AnnaLaura Brown, host of the Autoimmune Rehab podcast, where we talk about how to actually thrive and heal your autoimmune condition rather than just coming it up with pills or changing your diet and hoping you'll feel better one day. We feature solo episodes on helpful topics and interviews with guests who have actually walked in your shoes with autoimmune disorders and/or who have years of experience in helping people to thrive and not just survive with autoimmune challenges. I'm a health coach who started this podcast because I was diagnosed with Hashimoto's in 2018 and I wanted to inspire hope and transform health for people with autoimmune challenges. So keep listening and let's get you the help and hope you really need. This is the Autoimmune Rehab Podcast. Okay, and today, everybody, let's welcome Jen. And I want to make sure I get the last name right, Jen Uschold, to the podcast. Did I get that
Uschold,
right?
but that's okay.
Okay. Why don't you start off by telling us a little bit about yourself and briefly why you're here?
Well, thank you for inviting me and having me. I'm excited to be here because this really fits with the professional work I do. I am a physical therapist. My name is Jen Uschold. I've been in that field for over 30 years. And in around 2015, I started to really dive in and learn a whole lot about pain science and pain neuroscience education and how that can help people with longstanding pain. And out of that, I did a fellowship in pain, and then I was asked to create a 9-month online program in lifestyle medicine. And lifestyle medicine is really a beautiful fit for people dealing with autoimmune because we're looking at lifestyle behaviors and how they can prevent, treat, and even reverse up to 80% of lifestyle related diseases. So there's a big crossover between the way we work with people with chronic pain as well as the way we work with people with lifestyle medicine, because we can't actually separate our immune system out from any other system. And the immune system, we kind of like to refer to it as the police force of the body. And so when you have a cold or the flu, you feel kind of miserable everywhere. And so what can we do to rein that in and help you feel better, especially as in the case with autoimmune? How can we settle that alarm down when we don't always need that five alarm bell? Maybe we just need a 2 or 3 alarm bell. And most recently, I'm integrating with both the pain and the lifestyle medicine is this idea of mental fitness. And mental health is a really important area of health and usually requires a diagnosis or working with a counselor. Mental fitness is no different than physical fitness. We don't need a diagnosis to work on our physical fitness. The same is true with mental fitness. And the mental fitness framework is a beautiful complement to mental health as well as the pain neuroscience education.
Yeah, that's awesome. That's a great intro for sure. And yeah, I have talked with other guests who talked before on this podcast about the importance of your mental health, your embracing the challenges that come with autoimmune and making sure that you address a lot of, like your mental health along with your lifestyle medicine, your gut health, your pain. All these things work together. And yeah, like you said, your immune system, you can't separate that out. And sometimes people think things like, oh, well, like I had a thyroid autoimmune and my thyroid's gone, so now I must not have autoimmune anymore. And it's like, no, that's not actually how that works. The same thing
Right.
is true for other aspects of your health. It's like you can't just separate one thing from another, which is one of the problems with our Western healthcare system, is that they just try to isolate each individual system with different specialists and things like that. And that doesn't really serve people's overall health. So you
Not at
started
all.
explaining to us a little bit about its concept of mental fitness. If you had to describe what mental fitness is in, let's say, maybe just 3 or 4 words, what would that be?
Harnessing your brain to be your friend more than your foe.
I love that. That's awesome. Harnessing your brain to be your friend rather than your foe. Love it. That's awesome.
Yes. And most importantly, it is possible and measurable on fancy brain scans called fMRI, where we're looking at real time activity in the brain, which is super exciting.
That's cool. Yeah, that's awesome. So, how does this whole concept of mental fitness or mental health, whichever we want to refer to it, because I know mental fitness is kind of a new concept, so a lot of people are probably thinking more mental health, even though you did a pretty good job explaining that that's really more, like the realm of counseling and therapists and that kind of thing. How does that concept relate to pain specifically?
Okay, I'd like to give you a brief overview of mental fitness based on the work of Shirzad Chamine, and his book is called Positive Intelligence, and then we can draw into pain pretty quickly. Broadly, the left side of your brain is where we harness our negative emotions. This is very broad. And then the right side is where we have our positive emotions, the ability to be empathic. This is where our drive comes from, our ability to really get creative and innovative. And so that's broadly on the right side. And so when it comes to this left side, there's 10 characters, so to speak. We've all experienced the judge, the inner critic, the inner voice in our minds. And so that is one of the characters. Then some of the others, I won't go through them all unless you want me to, but we have avoider, pleaser, hyper rational, hyper vigilant, and then we have several others. Broadly, that's what the mental fitness piece looks like, is we want to be able to first identify when those characters are showing up, then we want to interrupt them, and then we want to choose something to harness the ability of our right side to become the chosen path. We need to do the neural rewiring. We're really creating new neural pathways. This is the beautiful word of neuroplasticity that's been around for a few decades. So when we look at the idea of pain, if we look at maybe somebody who has a strong hypervigilant saboteur, that's the broad phrase for that, is this is somebody who is constantly in fear, so much anxiety about their health, about their pain, about their kids, whatever it might be. And so, one really important concept that I absolutely love about mental fitness is that generally, whatever your top saboteurs are, represent your greatest strengths that have gone a little haywire. So, somebody who has a strong hypervigilant saboteur, they have a very good sense of being appropriately vigilant and watching out for people and caretaking. However, if we go to that left side, then it becomes hypervigilance. This is that idea of the boy crying wolf and always seeking new ideas to try and fearing any movement. We want to tie that into pain. So many people with a hypervigilant saboteur, they are afraid to move. They are afraid to try anything. And, it may even come down to dietary changes if they're dealing with autoimmune. There's so much fear because they're anticipating the worst outcome. There is an acronym for fear: false expectations appearing real. Now, what happens in that is that really the nervous system becomes more sensitized when we become hypervigilant. And unfortunately, our intention is to reduce the pain experience. But when we're using that left driven side of hypervigilance, we are likely increasing the pain experience. So the first step broadly is to become aware and remind yourself, okay, is this something that requires vigilance or is it not? So another beautiful comparison is, before I learned mental fitness, I would talk to my clients about pain as protection. You put your hand on a hot stove, you are really, really glad that you feel pain because you don't want to have to wait 3 days to feel that pain. You don't want to suspect something is going on because you smell burning flesh. So pain is protection, and it can become too good at its job. That is a sensitized nervous system. With the saboteur network or positive intelligence, we also talk about negative emotions as being good. We do want negative emotions. They drive us to think and change. Otherwise, everything would be status quo. Again, if we go back to the hot stove, you put your hand on the hot stove, this is feeling a negative emotion. You're not going to keep it there for 2 weeks or 3 months. You're going to get that information. So take the information of the negative emotion, and then what are you going to do about it? Take your hand off the hot stove, and then what are you going to do about it? Often what we see in pain is that somebody's nervous system has become so very sensitized, it takes very little input to trip the switch. And that may be putting their hand on a countertop that feels warm because the sun was shining on it. Their nervous system perceives just as big a threat as if they had had their hand on a hot stove.
Wow. Yeah, That's interesting. I like that comparison. Yeah, it's not something I ever really thought of before, but yeah, that's interesting. So, what would be like the first step that somebody would do to, let's say, either recognize it or start trying to work on trying to fix that if they've got
The
themselves caught?
saboteur
Mhm.
aspect?
Yeah.
Yes. So it's great. I can send this to you. There is a free 5-minute online assessment that will actually help you determine what your top saboteurs are. And then the first step is to intercept it. And we cannot become good at anything, whether it is a sport, whether it is our career, whether it is math, whether it is a craft, without understanding it first, and then lots and lots of repetition. So when it comes to mental fitness, we need to understand what the saboteurs are and how they show up, and then we can start to take action. The same is true with pain. Pain neuroscience education has been studied extensively. It is no longer a question of does learning about pain help? It's more about how can we use this information best? So we know from, again, these fancy fMRI scans, when people learn about pain, the pain response or the areas of the brain that are potentially involved in pain calm down just from learning. And that's one of 20 plus tools we have to help people with pain and a lot of autoimmune and other chronic illnesses that are all evidence-based, non-pharmacological, and non-surgical.
Well, that's interesting. Yeah. So yeah, if you will send me the link to that quiz, I think that'd be helpful to a lot of people, and we will link that in the show notes. So if you want to go there, take
Absolutely.
the quiz, discover what your saboteur or what may be possibly triggering you as far as your neurological side of pain, that would be great.
Absolutely. And when they receive their results, if they're curious to learn a little bit more, there will be links for them, but also there's an option to choose to share it. So if anybody would like to share it with me, I would receive it and then we could have a chat.
Awesome, for sure. So do you do like virtual sessions with people to help people overcome that
I
kind of
do.
stuff?
I can
Include
do
people on their
one-to-one
brain
coaching
faster?
with the
Mhm.
mental fitness framework and pain coaching as well. I do in-person work if that's the best fit. And then also a really great way to get a base of the mental fitness is through a 7-week program that is both driven by an app that drops the content, gives you reminders in the day to do the exercises, and then there's once a week group coaching with me. So that would be live.
That's awesome. I love that concept because the reality is that a lot of people, especially if they're really dealing with pain, they forget things, and so reminders and that kind of thing is always a really good, helpful tool to have.
Are you interested in understanding why people forget things when they have pain
Sure,
or they
let's talk a
have
little
tested?
bit about that. How does that pain affect the mental health aspect of forgetting things and not remembering? Let's talk about that. That would be interesting.
Yeah, we refer to this as a pain meeting, the pain science geeks in the world. And think about there are 9 different parts of your brain that potentially participate in any pain experience. Now, they all have different jobs. Some has the job of digestion, some has the job of muscle strength and coordination, some parts of our brain have the job of memory and learning. And so when you go to a staff meeting, is anyone getting anything done? Not
Mm,
really.
not really.
Right. So if you're there and you're an accountant and you're in a staff meeting, your accounting work is not getting done. And so when we have all these different parts of the brain stuck in the pain meeting, that means we can have sore and sensitive muscles if our motor cortex is stuck in that pain meeting. It means we can have digestive issues and discomfort if that part of our brain is stuck in the pain meeting. And we have to be so compassionate with people dealing with these things because if their memory and concentration part of their brain is stuck in the pain meeting, they may well forget appointments that we really want them to keep. So that's a little bit of an overview and an understanding of how the sensitivity of the nervous system and the different parts of the brain can explain some symptoms that people have.
That's awesome. That's great. Yeah, that definitely makes a lot of sense. And yeah, it's definitely not something that I had heard before. So I know, you've explained this a little bit, the mental fitness concept and, obviously your primary training is as a physical therapist. So how can those either work together or be a little bit different? So if somebody's, either currently going through physical therapy or, they're thinking that they might need to do physical therapy, but they're also really intrigued by this mental fitness concept, how would that piece work together?
I have
Or
had clients do it in several different combinations. And I had one client who did, for some reason, did not want to take the 7-week course. And so he would come into our physical therapy sessions and he would want to do the mental fitness. And most people really like the hands-on table work in PT. Let's be honest. I've had a couple clients come in, they're like, no table work today. Let's just do the mental fitness. So that is one way to do it in a one-on-one. Now, the benefit of the group is we have research that shows we are 500 times more likely to work together towards our goals if we are in a pod or a group. So that's why the group framework is very powerful. So I've had some people pause physical therapy and do just the 7-week online coaching program. And then I've had others who have decided to keep doing the weekly physical therapy and do the mental fitness at the same time. So it really depends on the individual and what's going to work best for them, time, financially, and definitely with their goals. So a lot of the mental fitness and the pain science is empowering people with knowledge and strategies and then helping them to actually follow through on the strategies. Because we also know, research tells us that to actually get true transformational habit change, it requires only 20% knowledge or information, but 80% repetition. So no matter what it is that your audience is trying, 80% reps is going to help to that transition after you have the information and knowledge.
that's good. I like that. Yeah, for sure. And I can definitely see that because I know, at least from my own experience, after I did physical therapy after my knee surgery in 2022, a lot of times, the physical therapy, you'd go and then they'd give you these exercises and tell you to do these at home. But let's get real here. How often do people really do all the exercises at home that they're told to do? I know I didn't do them as frequently as they told me I was supposed to. So,
Okay.
makes a lot of sense.
I can introduce a pure PT concept here because that has been one of my pet peeves in my entire career is that people would come to me from other physical therapy clinics and, yes, I got these exercises and they bring like a folder of 10, 20, 30 exercises and they're not going to do them. It's overwhelming. And so what we need to do is get creative and insightful on what is the best 1, 2, or 3 exercises for each individual client. And I will ask my clients, how much time are you willing to put into this every day? Some of them say 30 minutes. Some of them say 5 minutes. And that's the program I make. And I had one client in particular, we started at 30. She's like, no, 15, no, 10, no, 1. Will you do 1 minute of exercise a day? She's like, of course I will. And that was her starting point.
That's good. That's a good point to keep in mind. So those of you that either are doing physical therapy or thinking about it, you probably want to keep that as one of the things in mind. And yeah, I love that you have the group virtual program. So, anybody who's thinking, maybe I'm already doing physical therapy, you're going to do it, but then they can also, join that group program and get the benefits of, the mental fitness to help with that mental health piece and the pain and along with the physical hands-on too. Yeah, that's great.
It's beneficial. I'd love to offer your audience 20% off. I can send you a code if that interests you for your
Yeah,
group.
why don't you send it and we'll see if anybody takes you up on it. But yeah, that would be great. We might as well have it, available. So yeah, if you're listening to this and you're interested, take her up on it. It sounds like it would be great.
Yeah, it's a powerful program.
Yeah, I'm sure it is. It sounds like it's amazing. So
Yeah.
anything else that you feel like you want to share with us? But other than obviously we'll discuss your contact information, some of the best ways to get in touch with you.
Hope. What I would like to offer is hope. And I like acronyms. There's an acronym I love around hope called Hang On, Pain Ends. And many of your audience have probably seen dozens and dozens of providers. And I
Mhm.
recently saw, well, a couple years ago, I was her 27th provider in 10 months. And one of her goals was to get to Budapest. And it's a beautiful thing because part of our work is direct, but a lot of it is also planting seeds and ideas. So she took the seeds and ideas, and this past summer, she sent me a picture from Budapest, and it was just beautiful. So I had a small piece in her story. So I'd like to offer your audience hope that their symptoms can change with knowledge, empowerment, and repetition.
I love that. That's great. But yeah, you're absolutely right. I think the average from people that I've talked to is around 4 or 5 providers, but I have had people tell me that they've seen upwards of over 20 providers before. So yeah, it's definitely a big problem in our space that people don't get that help they need the first time they go to a doctor, which is a shame. It would really, help a lot more people if they didn't have to keep going from doctor to doctor to doctor. But that's unfortunately, a reality that a lot of people in the autoimmune space deal with our healthcare system as it is. So, yeah.
Yes, and that could be its own 4 hour conversation. However, what I also like to say is that I want to believe that the clinicians are doing the best they can with the information they have. And when we look at pain science, our knowledge of how pain works has exploded in recent decades. And we were working on a framework that was literally 3.5 centuries old. So we're really working to disseminate this information. So thank you again for having me on, because there is so much we can do for pain. And the phrase, as you said, mental fitness, that's a newer phrase. We can improve the capacity of our brain just as we improve the physical capacity of our body, and we need to get it out there. So thank you.
Yep, that's awesome. Yep. So if you are listening to this, your last call to action is don't just listen, actually take action. We'll have the link below to the quiz. We'll have the link to our websites and information on our program. At least go and take the quiz, check out the program. At least consider actually taking action and not just listening. And I will end again with that acronym that's hang on, pain ends. That's great. I love that. Thanks again for coming on, Jen.
Thank you so much.